Hi, I'm Laura Moon, the Director of the Social Enterprise Initiative, and I am pleased to be here today with the winner of the HBS Business Plan Contest Social Venture Track. Welcome.
Thank you, Laura, and thanks for having me. I'm Sidhant, Jena, a current HBS student, class of 2011. Our company is Sonicare. Sonicare aims to transform the mobile phone into a medical device to help people in the developing world diagnose disease early. Every 5 minutes, nearly 100 people die from cardiovascular disease in the developing world. Sonicare's mission is to change that paradigm. We want to help people, health workers and physicians diagnose disease early such that these deaths can be prevented early.
And how did you come up with the idea for Sonicare?
Well, it was really the realization that current infrastructure in the developing world cannot scale to solve the problem of 100 deaths in 5 minutes. There's only about 11 million hospital beds and 5 billion people, but there's 2.5 billion mobile phones. So we thought, what if you could take a mobile phone and turn it into a medical diagnostic tool? And that was really the idea that we had, and we followed that through.
Tell me why people are not receiving these services today in the developing world.
Sure. So there's a huge shortage in the medical diagnostics available in clinics across the developing world. And that's because of 3 reasons. First is cost. Devices tend to be expensive, so primary clinicians or clinics cannot afford. Second is they are complicated to use. If you look at ECG, it has maybe a zillion buttons today, and a nurse or a physician in the developing world is simply not trained to operate such a complicated piece of equipment. And third, interpreting data from these devices. So if you, again, taking the example of the ECG, you need a specialist to actually interpret it. Without having that on the ground, there's simply even no use for these devices. And that's the reason why these patients don't have access to it.
And how does Sonicare address the solution to those issues?
So we take the most ubiquitous device out there, the mobile phone, and turn it into a medical device. A mobile phone is connected, so you can send data anywhere. It's simple to use. Everyone knows how to use a mobile phone. And third, it's cheap. You can get a phone for $50 anywhere in the world. And if you plug in a little sensor and download our software, suddenly you have a medical device that is capable of performing the most complicated tests needed to screen for things like heart disease and diabetes. We think that's pretty revolutionary.
And as you think of your long-term vision, can you tell us a little bit about how you anticipate the business will grow over the next several years?
Sure. So our first market is in India. It's a big country, and we aim to start there and hope to reach nearly 100 clinics by the end of the year. And then eventually keep adding not just clinics, but also the number of tests we can perform with the mobile phone. We see the mobile phone as a diagnostic platform. So, imagine doing an ultrasound with it, or analyzing your glucose levels with the phone, or even using it as a microscope. We think that is technically feasible, and it's a question of whether you can build a business around it, and we think we can.
So tell us about the unique skills and experiences that your team brings to Sonicare.
Sure. So our team combines experience in designing medical devices and also experience in distributing medical devices, both of which are critical to Sonicare's success in the future. So I have experience working as an engineer and also in commercializing medical technology in the developing world, whereas my teammates, Anshuman and Ikaro, are really geniuses with designing these devices that could work reliably and safely for patients. So I think we combine the business side and the technical side to make this happen. And again, we have an inherent motivation to make this happen because we've seen a lot of these problems firsthand growing up. So we really want to make a difference with our skills. I'm Sidhant, Jena, and I plan to use my MBA to transform the way healthcare is delivered in the developing world.